culprits for reflux, for most people, have to do with unhealthy eating and drinking patterns. I mean, the most dramatic one is a very recent case of a very lovely woman in her early 40s. She has 5 kids, and she has been complaining of primarily exhaustion with some associated joint aches, brain fog, and night sweat. And I identified that she had pretty significant iron deficiency with borderline anemia and a low dose of estrogen. They played with it a little bit, and literally within 3 months, she felt full energy, 0 night sweats, perfect night sleeping. She's much more capable of managing her life. I couldn't help her with this, and I tried again through the allopathic channels to get her fixed, and it didn't work. And I acknowledge, like, I'm not everything. I need your help.
I'm Dr. Roberto Tostado. I am board certified in regenerative medicine after leaving allopathic medicine 20 years ago, and somewhat of a rebel to help people transform their lives. And on today's show, I'm so happy to have Dr. Ed Goldberg, who's a concierge physician. He's board certified as an internist and a fellow in gastroenterology who practices medicine with a more holistic approach. And as he likes to say, with the attitude of a country doctor. And thank you, Ed, for being on the show. I really appreciate this.
Robert, thanks for having me. I really appreciate the time.
Absolutely. And these conversations are really to educate the audience, anyone listening, in terms of the types of doctors that are out there where we actually care. We actually want patients to feel better. We want them to understand that there's ways that they can adopt and get educated so that they can lead healthier quality lives. And so I want to start off with, because I really love what you say and how you describe yourself with this kind of country doctor attitude. And if you could just elaborate for that
Sure,
audience.
happily. So, oftentimes when I'm encountering a new potential patient, we'll have a meeting to see if it's a good fit for both of us. And I will often describe myself as, like all doctors, I treat and diagnose a lot of different diseases. As an internist, I manage hypertension and diabetes and heart disease and strokes, cholesterol, all that stuff. But really, on top of that, what I really am interested in pursuing with my patients is twofold. One is quality of life, and the other is prevention. And you'd think every doctor is after that. It's just that in the climate in which we all practice, a lot of allopathic docs like myself who practice pretty bread and butter medicine just don't have the time to get into the detailed exploration with their patients about their lives and their lifestyles and what works and what doesn't. And to me, that's what a country doc does. They go to the patient's home, they get to know who they are, they know their family and their pets, and all that stuff.
No, you're touching on a point that to me is one of the most critical points when it comes to healing and health. Because if we only teach, or I should say, if we only see clients as a disease or as an organ, as a thyroid, as a liver, I think we're missing the point.
I couldn't agree with you more. And actually, to that point, as we had discussed when we first met, I'm also a gastroenterologist. And it's pretty unusual, especially in New York City, for a gastroenterologist to practice primary care medicine because it's a subspecialty. And in New York, we're all subspecialists. I never derived joy from focusing on a single organ system. I really like to get to know the person, as you said, holistically.
No, absolutely. And so, with your mindset of that country doctor, getting to know the person, I think that is one of the major parts of helping people heal. Because, as I mentioned at the top of the show, the reason I had left allopathic medicine was I was going through an experience where I felt that I was being controlled by the HMO system that I was in. And you use drug X, drug Y, drug Z. And like you're saying, it's so true, Ed. It's not like you have the liberty to spend 30 minutes with a patient. It's a conveyor belt.
Yeah. Absolutely.
At the time I told my wife, I think I'm going to quit medicine because I felt spiritually crushed.
Yeah, I
And I want to
agree.
have you elaborate right now on concierge medicine. And my point is that so going in this whole direction of what's known as regenerative medicine to help reverse chronic disease or prevent disease, as you said, it allows me to spend an hour with the patient, and I don't have to have a lobby with 40 people waiting. And
Right.
so, unlike at the HMO, and so, like you said so poignantly, Ed, it's yes, it's understanding what is your lifestyle. Do you have fun at home? What about your relationships? Are they toxic? Do you get along with your spouse? And the reason I bring this up is because I remember having a patient that came to me almost every week with a different complaint. And everything I did when I was at the HMO never helped. Drug X, drug Y, drug B, drug A. And so I was getting frustrated with myself because I thought I'm a terrible doctor because I can't help this person. Well, after almost a year of this, what I realized was I had an instinct, and that was I think what's happening is that every time she tells me about a different problem, it's based on her marriage. And so she
Mhm.
probably been married for like 40 years. And I told her, I think I have the solution. So I took out my prescription pad and I wrote stat divorce and I handed it to
Ah.
her. And she knew I had a sense of humor, but at the time, I kind of kept a straight face and I just handed it to her. And she looks at me, and she's nervous. She doesn't know if I'm serious. And I said, that's going to help you more than any antacid. And I walked out.
Yeah,
So it goes back to what you're saying, Ed. And my question is, how much time, or if you could explain to the audience your practice, concierge medicine, and how much time you're actually able to give a client when
sure.
you see you.
Um, it's interesting. When I spoke to a friend that I was going to be joining you on this podcast and explained a bit about your work, uh, she asked, "Well, why are you on that podcast? You're not an integrative regenerative doctor." And I explained that I think there's a lot of overlap in holistic approaches to care. And I have a number of patients who pursue integrative and regenerative medicine, and I work closely with them.
Mhm,
So I thought it was really good synergy. Um, so my practice, I'm an internist and a gastroenterologist. I've been through every different machination of practice, as you've explained. I started before HMOs existed. Then I got involved in HMOs and found that the only way I could earn enough to pay my staff was to see a patient every 11 minutes, which
mhm,
was soul crushing. So in 2009, I decided to step away from the insurance end of things. And in 2014, I started a concierge practice, which has lots of different definitions. Another term for it is direct primary care or DPC. It's basically a membership based practice where patients pay a single annual fee that covers them for everything that gets done in the office and pretty much ensures them that they have instant access to me and the services I offer. Um, when the way it usually goes, people will call, they'll inquire, we'll set up a meeting for a meet and greet where we spend about half hour, 45 minutes to an hour, not discussing medical topics in detail, but just to get a sense of who the person is and for them to see who I am to see if we're a good fit because it's a big commitment on both sides to embark upon this relationship. Then, once it's established that we want to see each other, we arrange for an initial visit. That's usually a 2 hour visit. And then every follow up thereafter, I book an hour. I don't always take an hour. If it's, a follow up blood pressure check, we certainly spend time chit chatting, but that doesn't take an hour. But the benefit of it is, as things arise spontaneously during the visit, I do not feel rushed. I don't feel pressure and I welcome it. I love getting to know people. I love getting to talk about their stuff and getting creative about how to make things better. My goal, I will often say this to people, is for people to have the ability for tomorrow to be the best day of their life. That's what I'm after.
yeah.
So
Do you ever come across this, Ed, from your patients? And that is because I hear this a lot sometimes over the years. It's expensive to be healthy, and but I give them the contrary. Is it inexpensive to be unhealthy?
Mm,
And so I wrote this in the book that I wrote, that I sent you a copy of, in that I've come to kind of the whole idea that it appears in our current medical system that we're either co-paying for disease or we have to invest in our health. And it doesn't
yeah,
necessarily mean financial. Yes, there's that part of it, but it's about lifestyle, is what you and I are really talking. I mean, I hope that people just heard what you said. You'll spend 2 hours in an hour or a half an hour. That's unheard of when you and I were at HMOs. I used to call my colleagues the 2 minute men, in,
yeah,
out. You have
yeah,
questions, next time, and next time never happens. But
yeah.
I want you to elaborate on that, Ed, because that's so critical what you were saying, spending the time with the patients. But I think we do have to understand, we do have to invest in our health, in our lifestyles, in our eating, in our thinking, and in our being altogether.
I think one of the trends that you and I have both experienced, most likely, is that the kind of people who are attracted to what we're doing
Mhm.
tend to be people who are willing to take extra steps to make themselves healthy. They tend to be people who are interested in the advice you have to offer and are more likely to follow it than, say, a patient we were seeing when we were in an HMO setting. Um, it's not uncommon for me to encounter people who are truly looking for a magic bullet for health or longevity, and there is no such thing. The magic bullet, in my opinion, are the basics of, a joyful life and a good diet and a good night's sleep and not being overweight and not drinking too much and not smoking, the basics. There's no magic pill, but there's certainly things that we can do. And I suspect things that you do on your end that I don't offer that can actually help people's physical sense of well being. So, people will sometimes say, like, how do you work with integrative doctors, regenerative medicine? I know my limitations. I have a patient now. She's been suffering for a number of years with night sweats and fatigue and brain fog. I think she probably has long COVID. And my brand of what I have to offer, it isn't working. She's not feeling better. And I referred her specifically to a local integrative doctor. And she's actually in 3 months starting to feel much better through some hormonal treatment. So I know my limitations and I like working with open-minded people. Yeah, it's rewarding.
No, no, and I think this is the type of synergy that needs to be established. It's very hard to find doctors like yourself in allopathic medicine, because I've really not run into it. Having this open mindset, working collaboratively with patients.
Yeah.
And I think this is the system that needs to be established, frankly, because obviously I jumped to this side of the fence, and it's funny because a lot of times when I help someone with diabetes type 2, or morbid obesity, whatever the case might be, and they start reversing this disease, that they no longer require medications for all the things
Mhm.
that we do. A lot of times I hear, well, what do I tell my real doctor, which I always found hilarious.
I know, right? Well, I'll say what my patient who has me as her real doctor, she says, "Well, I have to run that by my healer." She'll say that to me, and then I'll say to her, "But I'm a healer."
Well,
Yeah.
you're touching on yet another point of mine. I love that you said that, Ed, because I had interviewed this other person not long ago, and she started this whole thing on an academy to teach wellness coaches. And she was like, "You see your doctor, but then go see your wellness coach, so you could feel good." And it brought to my memory. I remember I went to a market with my daughter when she was only 12 years old. This is about a decade ago, and she noticed, oh, this is the health food section. So then she said, well, this must be the bad food section.
So funny, right?
And I was like, bingo, she gets it. And I said, no, you're right. And so that being said, and I always say this, it's not that I'm saying that allopathic doctors are bad guys. I was one. And I think it was more like what you were saying, Ed. We're trained in a certain system. We're not taught nutrition. I don't know. Did you get nutrition in medical school? I didn't. Yeah,
Not a
that's typically the answer.
Yeah,
Actually,
no, no.
I'm lying. I think I went to Michigan, and I think I had one one 45-minute session
Yeah,
where
that's about what we had.
about 10% of the class even showed up to that lecture, and at the
Mm,
lecture, half were asleep, and that's the only lecture I was really excited about.
yeah,
And that's, I think, what's really unfortunate right now is that I think the medical school system really needs to understand. And here, I want your thoughts because I truly believe that what has made us so sick and how metabolic disease has become the true pandemic with the obesity, diabetes, high blood pressure, heart disease, cancer, everything going this way. And you're seeing it
yep,
in children. And a study came out of Duke University 2 years ago, and that it was astounding because in that study it said 90% of this country has a metabolic disease. 90. I mean, that's astounding, impressive, and pretty pathetic.
yeah,
And so I just wanted your thoughts on food in particular, because I truly believe this whole correlation with all the processed foods and the the push for low fat diets have made us the fattest, sickest society. So I just wanted your input on this.
yeah. I think as a culture and a society, we really started going wrong in the 50s when food became so processed and canned and packaged and very far from what it originated as. And it creates tastes in people that are breakable. One can alleviate oneself of a sugar addiction. One can alleviate oneself of a processed food carbohydrate addiction. One can alleviate oneself of a Diet Coke addiction. I know because I did. I mean, I used to drink a ton of Diet Coke. Now I only drink water and seltzer. And I find Diet Coke repulsive, whereas I used to crave it. It's like these food companies really know what they're doing in terms of creating addictive products. It's just like tobacco. I really do think that it's not difficult to give basic advice on diet to patients, like try your best to avoid processed food, don't drink too much. But in order for them to really incorporate it, that's where I think somebody other than me needs to get involved. In my practice, that's how it works. I don't have the training or the bandwidth to really sit and go through a food history and create new patterns of eating. I design it and then refer people to the appropriate people for it.
Yeah,
But I couldn't agree with you more that the sickness of the nation has so much to do with the food product that's on most shelves that looks nothing like real food.
absolutely. In fact,
Yeah.
there was this previous podcast years ago during the peak of COVID that I had, and on every episode, I would end it by saying that health begins on your kitchen table, not the doctor's office. And I want it
Mhm.
really to resonate with people to understand that yes, there's acute care, absolutely, surgery, hypertension, or having a heart attack, having a hypertensive crisis, and those things obviously you don't see a regenerative doctor for. Um,
No.
and but the point that you and I are discussing really is to try to get people to understand how they can have more quality life to prevent disease, like what you're saying, or if you diagnose something on your end, how you can help them start to improve their health and to go on this whole trajectory of having a better quality life.
Mhm.
And one thing that I do teach patients is that the two healthiest cultures in the world have been the Japanese cultures and the Mediterranean cultures. And I so cross culturally, I tell people wherever your background is from, if you can incorporate those foods, healthier fats, things like avocados or olive oil,
Yep.
fish fats, and like what you said, get away from all these prepackaged foods. Or the whole thing I learned years and years ago was stay on the outside aisles of a market and
Yes.
the inside aisle, right? That's where the
Yeah.
processed food is.
Yeah. The other key thing here, at least in my practice, it might be your patient population might be slightly different because they're seeking an integrative regenerative doctor, I I am quite attentive to trying to meet people where they are and push them a little further.
Yeah.
If I sit down with somebody who's really eating poorly and I say, we're going to change this up completely and you're never going to eat processed food again, it's just not going to work.
Yeah.
There has to be incremental move,
Yeah.
and I think this goes not just with diet, but it's with everything. I'm probably more inclined to prescribe prescription medication for people's lipids or blood pressure. And very often I met with people just today, in fact, was somebody who does not want to go on a statin for his high cholesterol. I absolutely do not sit in judgment. I feel strongly, strongly philosophically that people have a right to their own self determination. People who see me kind of use me as a guide. They appreciate, I hope, my advice, and I appreciate the fact that they listen. And as long as I feel that people have heard what I have to say, I'm on board with them making their own decision, and I don't have to agree with them. I think it's very important. I never realized becoming a doctor was going to make me so strong in my philosophical beliefs, but it is true how I find that, like, I maintain consistency by identifying what my beliefs are, and that's definitely one of
No, no, and it's very true. And in fact, but what's kind of ironic is when I get
them.
patients here, I feel like I'm the salmon swimming upstream because when I speak to them, it truly is a different language. And and so they're trying to process what I'm saying versus what they've been hearing for the last 30, 40 years from their HMO doctor.
Yeah.
And so it gets to the point where I tell them, I know we start with blood work. And that's one thing that I've been critical about in terms of allopathic medicine from my experience is that I felt that our blood testing was very limited and that it needs to be expanded upon so that we understand that hormonally speaking, from a toxicity perspective, on top of, I mean, you as a gastroenterologist, you must be seeing so many cases of, or know of so many cases of fatty liver. That's become
Mhm,
epidemic. It's
mhm.
incredible. It's incredible
So
how much
many.
fatty liver. And and so my point being is that it really is about, like you were saying, it is a middle ground because I have to talk to people about, and what I find, okay, let me say this first. What I find really amusing is because we have this whole 21-day detox process where it's all about food. It's kind of funny. It's like people go through detox for, whatever, hardcore drugs or alcohol.
Yeah.
And this is a food detox where, all right, we're going to get you off McDonald's. We're going to get you off sugar and soda, whatever. And in 21 days, people go through these incredible transformations. And, but at the very beginning of these transformations, they're always saying, and they're very serious when they ask this question, what am I supposed to eat? And
Yeah.
I always found that so amusing because I'm thinking, I'm convinced, Ed, that anyone born from 1980 forward has been brought up on purely processed foods
Mm.
because when you tell them, there's such things as like vegetables and fruit and healthy fat, what
Fruits,
healthy
right.
fats,
Yeah. Right.
better protein choices, and they're like,
Yeah.
I really don't know what you're talking about. Or beans, like, what? I don't know about beans. And when you introduce wholesome food, and by the way, I am not an advocate per se of any specific style of eating, like vegetarian or Paleolithic. What I tell people is everyone should just strive to be a whole fooditarian, whatever, a fresh
Mhm.
fooditarian. And so my question is from your perspective, as you have your gastroenterologist hat, what sorts of things or trends have you been seeing over the years in terms of what a lot of people have to contend with or the issues that they're facing?
Well, I clearly see a lot of reflux, a lot of indigestion, which can easily be defined as like anything that's going wrong with your intestines, whether it's burping or flatulence or bloating or cramping, and then bowel movement issues. So, the I I think the main culprits for reflux for most people have to do with unhealthy eating and drinking patterns. Um, it's very common when I put someone on an anti-reflux diet, which for me just means calorie restricted and timing it so that you're not eating shortly before lying down. The minute people start losing weight, their reflux improves. So it's like this double feed thing where you get this double benefit. And as soon as their weight goes back up again, the reflux comes back. I mean, that's just an easy classic one. You mentioned fatty liver. Um, it's rampant. I will say, to be realistic, in my experience, I have not seen many people get into late stage trouble from fatty liver. We do know that it definitely increased the risk of
Sure.
fibrosis, cirrhosis, definitely. And it's a contributor, especially if people have other risk factors like excess alcohol or genetic predisposition. But most of the time, the people I see with fatty liver, I see mild elevations of their liver enzymes, and it doesn't go on to become cirrhosis. But we don't want that to happen for people because really, in my world, the way to fix fatty liver is to lose weight. I don't typically see it in people who are not overweight.
Right.
So the GLP agonists have been very effective, and I've had a number of patients whose fatty liver has completely reverted from
Right.
going on a GLP agonist and having weight loss. And we have sequential abdominal ultrasounds, and we see that it goes away.
Yeah, and I'm glad you brought that up, the GLP agonists. Um, we have introduced those, the semaglutide in particular, tirzepatide, if I'm pronouncing it correctly. I'm terrible with names. And however, with a caveat, because I do tell patients at the outset there is muscle loss with these GLP ones, along with the fat loss. And I tell them sarcopenia or lack of muscle in itself can lead to a lot of issues, chronic pain, whatever the case might be,
Immunologic deficiency.
neurologic. And so what I introduce from my end is what's called plant-based bioidentical hormone replacement,
Hmm.
testosterone and estrogen. And this
Mhm.
plant-based hormones have actually been around since the 1930s, which shocked me because I thought we would learn this in medical school. Obviously, we didn't. And my point is I tell my patients, look, yes, you're going to lose weight, but by introducing to men and women plant-based testosterone, of course, women and men have vastly different doses. And
Mhm.
this way, we're preserving muscle as I'm
Yep.
encouraging activity, resistance
Yep.
activity in particular. So as they're losing weight, at the very least, we're helping to preserve muscle weight. And
Yep.
so that way, people have that understanding that they can lose weight, be healthier. And as you said, okay, now we're touching upon liver inflammation or fatty liver. But at the same time, they're understanding, yeah, it's probably a good idea to stay away from things like all this bread and gluten and sugar, because that's going to contribute even more so to their fatty liver. So, my whole contention is to help them understand that it's not so much about losing the weight, but in this journey, learn to adapt to eat more foods so that after you're done with this process, at least you have that information, that knowledge to make the better food choices. No, no, I was going to say only because I would have patients come in and for the first time, and they would tell me they've been on Ozempic, with the other ones, Moderna, and um, and at some point they plateaued or wouldn't lose weight at all, even though I had been on it for a few months. And so my point to them was, oh, I would just ask them, so how are you eating? And yes, they were eating less, but unfortunately, a lot of these were eating less of the same junk food. And so my whole point was trying to get them to transition into thinking differently. But go ahead, Ed. I want to hear what you were going to say.
Well, just going to say when it comes to my prescriptions of GLP agonists, I'm pretty rigid about it
Yeah.
in that if a person is not, and I'm assuming they're telling me the truth when I ask them these questions, but if they're not exercising regularly and they're not eating healthfully, I won't increase the dose. I don't necessarily cut them off, but
Right.
oftentimes they want to push the dose and they're not getting anywhere. And I have found repeatedly when people plateau, as soon as they fix their diet and exercise without adjusting the drug, it brings about metabolic change and people do much, much better.
Right.
Yeah, it's pretty dramatic.
Absolutely. And so, now, so you mentioned that you work closely with to this day with integrative doctors to work collaboratively on patients, and so that people could hear the audience cases, one case or two that comes to mind of where you felt just really happy about the outcome of a patient where you worked together with these other doctors in whatever type of case it was, and where both you and your colleague contributed from your own specialties, and the winner here, as I like to say, has to be the patient. They have to be the
Absolutely.
winner.
I mean, the most dramatic one is a very recent case of a very lovely woman in her early 40s. She has 5 kids, and she has been complaining of primarily exhaustion, with some associated joint aches, brain fog, and night sweats. And so I did my thing and I identified that she had pretty significant iron deficiency anemia, but pretty significant iron deficiency with borderline anemia as a result of having her periods and blood loss. And she wasn't taking an iron supplement. So I got her iron back up to normal and her blood count back to normal. And she felt an incremental improvement, but all the other stuff was still there. I referred her back to her gynecologist who only does GYN, not OB, so is used to seeing older women. And she said, well, you're too young to be perimenopausal, and I don't see any place for any hormone replacement. So, see me in 5 years for that. So together we found an integrative uh, practitioner who focuses on perimenopausal women. And she went and she saw her and was put on progesterone and testosterone and a low dose of estrogen. They played with it a little bit, and literally within 3 months,
Mhm.
she felt full energy, zero night sweats, perfect night sleeping. She's much more capable of managing her life now. And I couldn't help her with this. And I tried again through the allopathic channels to get her fixed, and it didn't work. And I acknowledge, like, I'm not everything. I need your help. And when I get it and it's helpful, it's really amazing. So that's one really dramatic case. And as a result of that, I have another patient who mimics her almost identically. And I've been trying to get her to go down this path, and she's finally going to be willing to do it. So talk to me in another 3 months. Hopefully, I'll have another one that feels much better.
No,
All right.
you were saying this other patient, she's mimicking the first case.
Yeah, another patient who has nearly identical symptoms, and I've done everything I can come up with to try to help make her feel better. It's not working, and I'm urging her to go get evaluated by this same person, and she's now hopefully going to do it. So I said, talk to me in 3 months. Hopefully, we'll have another one.
Well, look, Ed, believe it or not, it's been, yeah, almost that time here, and
Oh, well,
this has been an incredible conversation because,
yeah.
and I truly mean this when I say this. It's rare to find doctors like yourself that work collaboratively with integrative medicine, which I think is wonderful. I really do.
Well, thanks. I appreciate you saying that. I think,
You're a unicorn.
you know how it is in medicine. Doctors can be really judgmental and
Yeah.
really judgmental of other doctors
Oh,
and
absolutely.
turn their nose up at different, the nephrologist turns their nose up at the urologist and vice versa. So I find like there's no benefit to the patient in that. And we're all in this for the same thing, right? To help people feel better because it makes us feel good to do that. So hats off.
That's why we do this. I
Yeah.
believe.
Yeah.
And as I said, and I truly believe this, the winner from all this should be the patient.
I
Otherwise,
agree.
what are we doing? And
Absolutely.
so, do you have any message that you want to leave with this audience, Ed? Any last parting words that, from your experience, what it is that you would like to just leave with?
Yeah, I mean, I do think that for patients, it is really frustratingly difficult to find a primary care doctor who has the bandwidth to really feel you. If you live in a part of the country where you have very limited resources, you're stuck with that. But if you live in a city and you see a doctor who you don't really feel, find a new doctor. That's what I'm saying. Like I see too many people who say, "Yeah, I see my doctor. I don't really like her, but find a new doctor." Like we're ubiquitous where we are. If you're in a city.
And again, I think it's very unique what you bring in terms of being a country doctor in a huge city with that attitude of really relating to people. And people need to understand from your experience and my experience, it's rare to find doctors that really want to connect with you and
Yeah,
want to see the whole of you and not just that's your diagnosis, that's your
yeah,
organ.
yeah.
And so I think what you offer is tremendous, Ed. I applaud you. I really do.
Oh, thanks. And you, Roberto, absolutely.
No, no, thank you. Thank you. I appreciate it. And that being said, how someone looking for someone like you, how can they find you? How can they contact you?
Well, I'm easy. If you Google my name, Edward Goldberg, or my website is conciergemdny.com. But concierge medicine, as I started with, there's a lot of different definitions of it, and there's a lot of different price points for it. So people have options on that, and different practices offer different things. I think the key is for people to do their homework. Word of mouth's a good thing. And believe it or not, you can get a lot of information from looking at somebody's website, if you ask me.
Absolutely.
I
Well,
think
once
you can.
again, I want to thank you so much for being on the show, sharing
Thank
your
you.
experience and your wisdom, and so
Thanks.
that to get people motivated to see physicians like yourself and understand they can have a better quality life.
Yeah,
So thank you
right.
again, Ed.
Thanks, Roberto. Really appreciate it.
Absolutely.